The top infectious disease expert in the country, Dr. Anthony Fauci, giving his advice as the country goes through this summer coronavirus surge. 38 states heading in the wrong direction. A new daily record yesterday for coronavirus cases, new infections. Dr. Fauci says, do this.
I can say as a public health official that I would urge the leaders, the local political and other leaders in states and cities and towns to be as forceful as possible in getting your citizenry to wear masks.
Defining as forceful as possible is a fight across the country, including right now in Georgia. The governor says wear a mask, but he won't mandate it. He's now suing the city of Atlanta. The mayor there says, I will require masks to be worn. Let's go straight to Georgia. Dr. Harry Heiman is assistant professor at Georgia State School of Public Health. Dr. Heiman, welcome. Thank you for your time today. Are you here, Dr. Fauci? We know that masks work. In your state, cases are heading up, and the governor and the mayor are in this spat over a mandate. What's your take?
What's my take is that we're seeing very consistent behavior from our governor. I would say at every step, he's failed to show the kind of leadership that we need to appropriately respond to this pandemic. I think if you look at what's been going on in Georgia, candidly, it's not a whole lot different from what's going on nationally. There's been a failure of both the political and the public health leadership to do what needs to be done to address this pandemic. So in Georgia, we were slow to close the state back in the spring. We were the first to open. There was an opinion piece in the Wall Street Journal touting the Georgia model, and public health people warned at that time, if we do that, we can reasonably predict that in 2 to 3 months, we'll be looking at surging cases, surging hospitalizations, and surging deaths. And guess what? Here we are. I think it's hard to fathom that something as straightforward as mandating masks has become a political issue when the public health data about the importance of that is compelling.
And I want you to listen. This is just this morning that Kathleen Toomey, the Georgia Public Health Commissioner, talking about, you mentioned cases, hospitalizations, the death rate. She's also saying when you do all the testing, the positivity rate's going up. Listen.
Our test positivity rate on average is 13.6%, which reflects community spread at this time. And hospitalizations have increased 39% over the past week. We continue to see outbreaks in workplaces, in businesses, in congregate settings, daycares, camps, fraternity houses, many churches.
It's the list. It's the list there. This is not a meatpacking plant. This is not one church. It's everything. It's everywhere. How do you bend that curve, sir?
You know, what's stunning, John, is that in the face of this surging pandemic, there's a failure to adequately respond. I mean, you know, there was narrative both in Georgia and across the country about, well, you know, we're doing more testing. That's why there are more cases. Oh, well, we have more cases, but they're younger. They're not ending up in the hospital. Now the hospitalization's surging. Well, there's more people in the hospital, but they're not dying. Well, guess what? Now they're dying. So there's this continued effort to change the narrative. Again, the fact that our Commissioner of Public Health can say unequivocally that this thing is out of control at a time where their own containment strategy and contact tracing is only reaching about a third of cases is just unbelievable. The way you bend the curve is that you apply the policies that we know that work. Number one, you walk back the reopening. You know, if you think about the settings they just talked about, you know, churches, you know, we have amusement parks, camps, daycare. You know, we need to walk that back in a meaningful way. We need to mandate masks and support local leaders to do what they need to do to protect their population. I mean, look, the number one responsibility of government is to protect the safety and security of their population, and we are utterly failing.
Dr. Heiman, appreciate your time today. We'll keep in touch as Georgia and the rest of the country goes through this summer surge, and we hope very much that the numbers change soon. Appreciate your time, sir. More ahead.